discussion in our class, one of the things we're going to do when we meet up is I'm going to be posting pictures and see if you could identify some of the pathologies related to the dermatology chapter. So we're going to start out with urticaria. So this is a group of skin conditions, and the common presentation of this is the itchy wheal that forms, and this basically occurs because of a histamine response. And there's various forms of urticaria which we're going to show on the next slide and kind of discuss. But the histamine basically produces a vasodilation that causes local reddening, and then you get the flare and the tissue edema because of this as well, because basically again, when you have that vasodilation, the vessels leak, if you will, and fluid gets out into the tissue and causes the local edema. Another thing to note are the red flags for anaphylactic shock. Many times urticaria is associated with people having severe allergic reactions. So obviously we get concerned with anaphylactic shock about the respiratory difficulty and the cardiovascular implications related to that. Here are your common forms of urticaria. So important to kind of note the different causes. So most of these are either caused by some type of physical stimulus, or in the case, so for instance, like temperature, you notice the cold and the solar urticaria that are down there. The solar urticaria is more an exposure to the UV light, but you see here dermatographism, the induced by the rubbing or stroking of the skin. Literally what you can do with this in somebody is you could almost, like as the picture in the textbook shows, you could basically draw on the skin, and wherever the physical stimulus occurs, that's basically where the hive forms. So you can see a picture of that in the book. The cholinergic urticaria is caused by another type of physical stimulus. So again, just kind of note the causes here of urticaria, and again, as I had said previously, make sure to pay attention to the signs of anaphylactic shock. If you have somebody that does have an allergic reaction, beyond getting the hives, you have to be concerned about the ramifications of that as well. An epidermoid cyst. So these are various types of cysts that can form. Basically, most of the cysts that form are filled with a white keratin material produced in the epithelium. So these are lesions that essentially form typically in the more superficial areas of the skin. Here it has some of the more common sites where they actually do develop. And again, the key is finding out what are the contents of the cysts. Like I said, most of them do contain almost like a white keratin material. If the cyst does rupture, it can produce an inflammatory response in the dermal layer of the skin. But there's various forms of this, and there's some points in the differential where there may be some other conditions that look very similar to this. So, for instance, the differential here would include things like different types of abscesses and boils, or even just regular skin tumors can be included in the differential for this condition. Eczema and atopic dermatitis. So eczema usually indicates a vesicular dermatitis, and some people just refer to eczema as atopic dermatitis. Atopic dermatitis itself is just a general dermatologic reaction between the environment and genetic factors. So these are your two most common inflammatory skin conditions. Usually eczema, they usually just kind of lump these all together. There are separate causes of this, so most people again, it's a general inflammatory response. You do see this a lot in children. Most of the extrinsic causes of this involve some type of allergic reactions, either to food. Even airborne allergens can potentially cause this as well. It is very itchy. It does produce a lot of pruritus, and patients could usually very rarely are able to avoid scratching it. It's not uncommon for young children who get this. They tend to scratch it a lot. You obviously have to be concerned about secondary infections. So when looking at this, again, the key is just kind of finding the cause. Again, look at some of your other conditions that look very close to this. Differential diagnosis is going to be really important with the skin conditions, because again, a lot of things sometimes look and mask itself like other conditions. So make notes of those as you're going through and reading about these different conditions. Psoriasis is a genetic chronic recurring disorder. This is something that usually begins in childhood. The key findings here are a scaling papular infection looks kind of similar to eczema. However, it does not have epithelial eruptions. It doesn't have wet areas or crusts. And the most common associated with this is with the immune system. This is something that can be triggered by trauma, infection. Even medications can do this. It typically does have a gradual onset, and it could be pretty widespread throughout the body. Many patients who experience this also experience something called psoriatic arthritis, which is another autoimmune disease. So it's different from rheumatoid arthritis in that individuals with psoriatic arthritis tend to enter remission a lot more than individuals with rheumatic arthritis. So again, note the triggers for this. You can see what the distinct lesions kind of look like and where they occur. The classic presentation of this is it usually occurs on the extensor surfaces of the body. So, if you look at the elbows and knees, the areas where they form. However, there are other areas where the plaques and the scaling can form. It could, a lot of times, like on the back of the neck. It could even go on like the scalp, and even in the gluteal region are common areas where you would see this. So in looking at skin cancer, so there's different categorizations of skin cancer. So these are important things to be able to screen for if you have an individual who is concerned about a lesion on their skin that's possibly evolving and changing. So it's good to be able to kind of note how kind of looking at screening for skin cancer works. So your non-melanoma skin cancers, so these are the skin cancers that don't tend to metastasize. They are the less serious forms of skin cancer, albeit any form of skin cancer does need to be treated. These are the ones that typically have a much better prognosis and fewer fears of metastasis. So these are the most common cancers in the world. They basically get classified as two types depending upon the type of cell that is affected, and again, be able to kind of separate and be able to distinguish even between these two types. So the basal cell carcinoma and the squamous cell carcinoma are the two types of non-melanoma skin cancers. Both arise from keratinocytes, and they usually don't spread to elsewhere in the body. They've actually, due to the rising incidence of skin cancer, the NCAA has actually issued in the sports medicine guidelines in 2012, they actually started to introduce safety measures to avoid skin cancer. So it's definitely something that you should be able to, be able to look at, or if a patient would be able to bring a concern, you'd at least be able to guide them in the right direction. Melanoma, this is a skin cancer that arises from melanocytes, and they show the areas where this can be found. This is where now you can get metastasis. The most common types, superficial spreading melanoma and nodular melanomas, are your most common types. Individuals, obviously, so look at who's most susceptible to this. So what are the the physical characteristics of individuals who tend to be more susceptible to melanomas, so make note of that. This does tend to be the type that creates, there's a lot of mortality associated with melanoma. So again, if found early, obviously the prognosis can be very good. However, this can also, it's very common to have this metastasize to other areas of the body. And here are I sort of alluded to this in the discussion in class, the ABCDEs of melanoma. So the mnemonic here, so asymmetry, border, color, diameter, and whether or not it's evolving, meaning is it a mole that is changing. So these are basically just ways you can kind of, if again someone were to bring a concern about a mole that they have, and be able to distinguish, is it something that is possibly a concern. And again, there's some pictures in your textbook, so make note of those. But again, this could kind of guide you. So you look at asymmetry. In other words, if you take the mole, if you fold it in half, does it have equal right and left sides? Is the border regular? In other words, does it have a very distinct round border, or is it a border that kind of fades off, or it's kind of difficult to trace? Look at the color, okay? The diameter. Typically, cancerous moles tend to be less than 6 millimeters. Now, it doesn't mean that if it's so small and that it can't be skin cancer, it's just highly unlikely and evolving. Does it look to seem like it's changing in shape or size? Okay, frostbite. So this is a condition, obviously in extreme cold conditions, whereby you get vasoconstriction in response to the cold that results in freezing of body tissues. So, literally in this situation, you get basically ice crystal formation between the cells and the skin from the extremely cold temperatures, and you have both intrinsic and extrinsic risk factors that contribute to this. Your intrinsic factors are things like fatigue, circulatory impairment, malnutrition. Individuals that have had a prior history of cold injuries tend to be more susceptible. Your extrinsic and environmental factors, so beyond just cold temperature, you have other things that provide extrinsic risk factors as well. So wind chill is a big deal, high altitudes, how long the individual is being exposed to the cold. So these are all different things that kind of contribute to some of the extrinsic factors. Now this is differentiated between different degrees of frostbite, so make sure you could differentiate between, first degree through your textbook classifies up to fourth degree frostbite, so make sure you could kind of see some of the different things related to that and the treatment. They also do give a brief mention in comparison to what hypothermia is. So hypothermia is more of a systemic presentation of lowered body temperature, which is actually a more severe condition. So if you have somebody that is suffering from hypothermia and frostbite, hypothermia is the main concern just because of the more systemic ramifications associated with that. But make sure to kind of note the treatment for frostbite as well, just as you would anything else, because this could be something that commonly, especially in outdoors where you have climates that are a little colder, this could be a big concern. Bacterial conditions. So again, part of the things that we had mentioned were kind of noting what's the pathology behind the condition. So a lot of the conditions that we've just talked about, most of them were non-contagious conditions caused by physical trauma or some type of other stimulus producing it. When you're looking at a lot of your infectious conditions, now you're starting to look at things that are more likely to be contagious. So very important to be able to distinguish between what's contagious, what's not. Another thing to note are the NCAA guidelines for wrestling for return to activity. So that will be something that there could be test questions on. So pay close attention to that as far as what are the ramifications as far as return to play, how long do they need to be medicated for, what type of medications, and how the lesions, if a lesion can or can't be covered. So we'll start here looking at the bacterial conditions. So most of the bacterial conditions are either caused by a Staphylococcus or a Streptococcus bacteria. They're responsible for most of the bacterial skin conditions that you will see. And the typical cause of this is a break in the skin. Again, that's why it's so important to, again, wound coverage during activities to prevent possible infection. Another thing to note is that many times bacterial and viral conditions can coexist in the same infection. So that sometimes does make treatment kind of difficult with this. So it's really important to be able to identify these conditions early on, particularly when you have very contagious skin conditions that have other ramifications. So things such as MRSA, the methicillin-resistant Staphylococcus aureus, which we'll mention a little bit more later on as well. But to be able to differentiate that, because there are obviously that's something that can spread and have much more serious ramifications. Impetigo is probably the most common bacterial skin infection in children. Usually this will occur in an area where the skin has already been compromised. So if there's a previous skin disease or injury where basically the integrity of the skin has been compromised, it can make a young child more susceptible to getting infected with this. It is transmitted by direct skin-to-skin contact, so here we are looking at a contagious condition that there will be some guidelines as far as return to play and how long a person will have to be medicated for and what are the characteristics of the current condition as it presents. There are basically two forms of impetigo. There is the non-bolus and the bolus presentation of impetigo. So the non-bolus impetigo presents with a little more of the classic honey-colored crust lesion, if you will. So that's a very common way to kind of see impetigo get presented. So be able to differentiate what it means for it to be the non-bolus versus the bolus presentation. Both of them do have some similar qualities. However, like bolus impetigo typically presents commonly with like the moist red skin and then progresses to the larger vesicles during the presentation. Is an inflammatory reaction of the hair follicles. So we have the most common areas where this could present. Many times this is the common cause of this, particularly for males, is shaving with a razor blade. So basically what happens is you have an individual who maybe has a smaller, very focal area of this, and they go and shave the area, basically causing it to then spread. So that's where you see individuals that kind of get the widespread folliculitis on their face, usually because it gets spread with a razor blade. Other common things where you can see this is it can get contracted from hot tubs and pools. So it's really important, in a sports medicine facility, if you're using your whirlpools, make sure that they're sanitized appropriately so that you don't end up possibly harboring the bacteria associated with this. Abscesses, furuncles, and carbuncles. So abscesses in general are just collections of pus. So they could arise in a variety of locations. When you have an actual furuncle or a carbuncle, now is basically where you have the walled off abscess. So this is where you'll actually have the lesion formation, whereas when you have an abscess, it's just the pus collection in the skin. Once it gets walled off, you then have the formation of what's called a boil or a furuncle. If you do get several furuncles to coalesce or come together, you basically get the formation of a carbuncle. So that's basically a group of furuncles that have kind of amassed together. Again, the key here, and it's actually a condition highlight in the textbook, is being able to differentiate particularly conditions, because they could look very similar to this is MRSA. So the methicillin-resistant Staphylococcus aureus. So at one time that was something that was typically only contracted in a hospital setting, but because of the widespread use of antibiotics and the fact that bacteria, mutate and find ways to adapt, you have a group of staph that basically has become resistant to our very common antibiotics that are typically prescribed to deal with these things. So if someone does have MRSA and they are prescribed an antibiotic because they think it's another type of skin condition to treat it, it might not be able to treat it, and then you run the risk of possibly having it spread. So it's really important to kind of note some of the things that can kind of highlight what MRSA is. So in your differential diagnosis, looking at what are some of the signs that could be cluing you in that this is something beyond just a local bacterial infection, like just a boil, if you will, when something is actually a MRSA infection. So it's important to kind of note that. So just to kind of highlight here, most of your regulations in regards to being able to participate once someone has a bacterial infection, you typically need to complete at least 72 hours of antibiotic therapy. An individual has to have no new lesions over the course of 48 hours. They have to have no moist draining or exudative lesions, so nothing that's actually producing any type of or excreting any type of fluid from it. If lesions are questionable, it's always important to have testing done on it. Again, particularly if you're worried about MRSA, for instance, if someone has what appears to be a boil and it starts to expand, it starts to get more red around the area, they get swelling around a joint that's close to an area, that's probably a more serious bacterial condition and could possibly be MRSA. So it would be important to have that person just so they could get the right type of medication. And with these bacterial conditions, active lesions can't be covered to participate. So you can't just wrap these up and have an individual participate. They need to basically be treated appropriately and have no new lesions and not have them draining at all. Okay, acne is a condition that commonly occurs where the concentration of sebaceous glands are the greatest. I mean, it can occur anywhere on the skin, but most commonly areas of face, neck, chest, back are more of the common conditions you would see this in. Very common in both males and females. It consists of both inflammatory and non-inflammatory lesions. So your inflammatory lesions involve the erythematous base, like the reddening, and the papules, pustules, or deep cysts. The non-inflammatory lesions are your open and closed comedones, or your blackheads and whiteheads. Okay, so a blackhead is when you have an open comedone. A closed comedone is when you have your whitehead formation, and they're basically characterized by their appearance. So this is both an inflammatory reaction and also a bacterial condition. So there's bacteria that forms with this. It is not contagious, obviously. So acne is not a contagious condition. So individuals can participate and have acne. It's not something that can obviously be passed on. However, in the differential diagnosis for acne, there are some, again, common conditions that could look like it that are contagious. So again, if there's concern that they do have a contagious condition, it would be important to make sure that that individual gets just referred for examination. Usually this is a pretty classic appearance though, and you could differentiate this from those conditions. Paronychia and onychia are different types of infections around the nails. So paronychia is infection that affects the proximal or lateral nail folds. So this is an infection kind of in and around the nail. You have a picture of it on figures 16, 17 in your textbook. Onychia is an infection of the actual nail itself. So basically, a lot of times what happens is this would be something common to see in like football linemen when they play in grass, from sticking their hands into the grass, into the ground. If they get some dirt underneath the nail bed, they could end up with an infection. So note the treatment of this. There's no participation restriction with this. Many times, just some simple over-the-counter treatments can assist with this. You just have to kind of monitor it to make sure that it's not spreading, or that it's not some other type of infection. You do also have to be somewhat concerned with immunocompromised patients if the infections don't clear up. Herpes simplex virus, this is an extremely contagious infection. It presents in various forms. It presents as cold sores if it's on the lip region, or fever blisters. There's also genital herpes and what's called herpes gladiatorum, which is the herpes gladiatorum is the common herpes infection that you see in wrestlers, where they get herpes basically on other parts of their body. There are various forms of herpes simplex virus. There's many different types. Basically, this virus will enter through the skin at the site of a previous injury, so somewhere where there's been a cut, an abrasion, if there's been damage, if the skin has been broken down because of eczema. And then it essentially follows a nerve root into the dorsal root ganglion in the spinal cord. So the infection basically sits there. So once someone's been infected with this, no matter which form of herpes it is, it basically settles in the dorsal root ganglion, and then they can have reoccurrences of the infection. So, and during the primary infection, someone may not actually develop a rash. They may actually just develop systemic symptoms related to it. So it's important to note, when your textbook talks about breaking it up, where you have herpes simplex 1, which basically occurs above the waist, so that would basically be your cold sores, or just your herpes rashes that would form, for instance, maybe on the arm or the shoulder of a wrestler. Whereas herpes simplex 2 is the genital herpes. But both are essentially the same type of virus. It's just based kind of upon the location of the infection. It's important to note not only the presentation of the actual herpes rash, also kind of note what the return to play would be, particularly for a wrestler. Again, note anytime there's NCAA recommendations as far as return to play with this or with other conditions, please make sure you note that. Molluscum contagiosum, this is another viral infection commonly found in children and sexually active adults. It's easily spread via direct contact. The disease itself is actually very self-limiting. It can actually respond on its own. However, obviously, if it were to be present in an athlete who wants to compete, they're probably going to look to have the molluscum removed. There's picture 1619 in your textbook, kind of shows what these characteristically look like. And again, as far as the return to play, these lesions, if they're too numerous or can't be covered, they actually have to be removed before someone is allowed to play. But just kind of note what the typical treatment is for these. Most commonly, they appear either on the face, trunk, arms, legs, and in the genital areas. Human papillomavirus, this is essentially, when you talk about warts, again, warts are caused by a virus. So the human papillomavirus is basically what causes warts in individuals. Again, common in young children, but they can occur at any age. They're spread by skin-to-skin contact. Again, any type of damage to the skin or compromise to the skin is going to create an area where this virus could basically enter into the body. And I give a little bit of a clue into the presentation here. Again, this is something that is contagious and would have to be dealt with as such when looking at treating an active individual. Okay, now we're going to look at fungal conditions. So we just gotten through some of the bacterial and viral conditions. Now we're going to look at your common fungal conditions. Most of these are caused by dermatophytes, which are basically superficial fungal infections of the skin. You could actually get fungal infections inside the body as well. Not quite as common as getting them on the skin, but they can happen on the body as well. So dermatophytes are the common cause of this. You could look and see, as far as being able to differentiate this between other skin infections, how they would do that. In other words, what type of testing would be done to differentiate a fungal infection from, a bacterial or viral infection if you can't tell just simply by the way it looks. We're going to talk about all the different fungal infections here. There is a table in your textbook, table 16.2. Compares the different types of fungal, or what are known as tinea infections. And again, here you see the most common areas where they're found. This is extremely common, particularly in wrestlers. So this would be something that if you're an athletic trainer responsible for providing sports medicine coverage for a wrestling team, really important to be able to differentiate this from other skin conditions. So here are basically your common fungal infections. So you have your tinea corporis, or what is known as ringworm. So that's basically your tinea infection on, say, for instance, the trunk, the arms, shoulder region would be areas where you would see tinea corporis. So it's basically ringworm on the body, essentially. And again, you hear the term ringworm get utilized. Tinea cruris is a fungal infection in the groin. It's known as jock itch. So that's another fungal infection. Tinea unguinum, which is ringworm of the nails. Tinea pedis, which is basically athlete's foot, or a tinea infection on the feet. Tinea capitis is scalp ringworm. And then you have tinea versicolor. So tinea versicolor is actually a yeast infection. So out of all of these, tinea versicolor is kind of a little different. This is actually something that occurs just due to the normal skin flora. So it produces an infection, but what essentially happens is when the natural skin flora becomes overactive, it produces the lesions that you find. Now, tinea versicolor is not contagious, so that is something to note there. But when you're looking at all of these, obviously note the common body areas where they occur, and also note what the lesions kind of classically look like, and then obviously your return to play, and obviously they would be treated with antifungal medication, but kind of note the name of the medications to be able to differentiate those from the other meds used to treat the other skin conditions. Okay, now looking at parasitic infections. So these are all infections caused by parasites. So your first one is pediculosis, which is a lice infection. So there's various types of infections caused by lice. They could occur in three forms. You could have head lice, body lice, and pubic lice. So these are essentially little parasites that feed on human blood after basically injecting their victim with their saliva. It causes severe pruritus due to the allergic reaction, because the parasite saliva causes an allergic reaction. These are basically spread by person-to-person contact. It should be noted that lice do not hop or fly, but they do crawl. So that's how they're basically transmitted. So louse don't essentially fly through the air. They crawl, and they get transmitted via direct person-to-person contact or person-to-object transmission. So the lice can obviously live off the body and get on other inanimate objects that can then be passed to individuals as well. So your common forms of lice, head lice, these live on the human scalp. They feed on human blood. They cannot survive without a human host for longer than 48 hours. So that's something to consider once if someone does have a lice infection, they have to consider their living environment and what they would have to do to kind of kind of treat everything just so they don't have reinfestation of the lice. So human lice can lay up to 15 to 20 eggs per day, so that can also be in clothing and bedding. So you have to make sure that, you know, clothing, bedding, other things would have to be treated, and how that would have to be done. And again, it could get passed on by person-to-person contact or person-to-object contact there where there had been lice in contact with it. Body lice. Now, lice aren't going to per se live on the human body, but they could live in clothing and bedding. So essentially what they would do is they would live on the clothing and bedding, and they would go onto the humans to, again, feed off of their blood. So typically that would happen at night. So if you have an individual who's noticing that they're having a lot of pruritus at night, and there was a possible lice infestation, that could be something that you could have the body lice. And again, they don't live on the body throughout the day, but they would live in the clothes, the seams of the bedding, and then just feed on the body at night. Pubic lice, commonly referred to as crabs. So this is lice that is found in the genital area, typically spread through sexual contact. It should be noted that the pubic lice may migrate to other areas of the body. So with all of these forms of lice, and particularly pubic lice, again, note how, again, not beyond the medication used to treat the individual, also note what else has to be done with household items, clothes, bed sheets, because obviously eggs can be left and you could keep getting chronic reinfestation of the lice if that does not get addressed. Scabies is a different type of parasite. So the scabies mite, what they essentially do is burrow underneath the upper layer of the skin and lay their eggs. So this is a little mite that literally goes underneath your skin, lays eggs, which then causes a lot of itching and irritation, causes little pimple-like lesions. It's very common in overcrowded places such as prisons, nursing homes, and dorms. Very challenging to eradicate. It's a little harder to eradicate than lice. It's spread via direct contact, sexual contact, sharing of infested clothes, bedding. So the scabies mites could also get into the clothes and bedding as well, just as the lice would. So there are certain areas of the body, typically between the fingers, where a lot of times the mite actually does burrow in, so you can kind of see what the presentation of that would look like, but the person would experience extreme itching from the irritation of the mite burrowing underneath the skin and also laying their eggs. And then to just talk about insect bites in general, and you know, your textbook does talk about some of the particulars with different types of insect bites. So as you go through your reading, when you're looking, for instance, at the case studies, you're just kind of going through your reading, take note of just some of the particulars, some of the things, for instance, certain spider bites that and the reactions that they cause, you know, different things caused by ticks, for instance. We know of one, Lyme disease. There's also something known as Rocky Mountain spotted fever is another thing transmitted by ticks. So many dermatological reactions to insect bites are common. What you have to be worried about beyond the systemic infections that can occur from different types, you also have to be aware of anaphylaxis. So again, at the beginning of the chapter and talking about hives, it notes anaphylaxis. Make sure that you're able to recognize that and understand how that's to be treated. So again, you have various types of biting insects, obviously. Some of them are listed here. You know, mosquitoes, chiggers, ticks, wasps, bees, ants, and spiders can all produce various skin reactions. So take a look at just some of the topical medications that can be utilized in the case that you have bites. And essentially, what are some red flags for insect bites? So there are red flags just based upon either how the actual lesions on the skin presents, if there are any systemic infections or systemic issues related to any of the different types of insect bites. Also note what should be used as insect repellent. at the very least, or what's commonly recommended, because that would be important to discuss that with athletes in certain situations as well. So that wraps up the discussion on the dermatological conditions. So again, one of the things I want you to do in conjunction with this video is look at the pictures, and even if you do get a chance, look at some pictures online of some different skin conditions, because this is definitely something where, you know, visually getting to see and getting used to seeing what some of these conditions looks like is important. We will be doing work with that in class as part of our in-class assignments on this chapter. So again, note your primary lesions, that's important in being able to distinguish if there are systemic signs and symptoms, the common medications used, you know, beyond antibiotics, antivirals, kind of note specific names of the medications to be able to differentiate and classify what the different types of medications are, and any other, you know, smaller details kind of within the discussion in class, particularly your differential diagnosis for each one of these, so that you could kind of at least be thinking about other types of infections if you can't narrow it down to you know, one definitive type when you're looking at them.